All right, and with that, I'm going to pass it over to our presenters.
Great, thank you. All right, so we're gonna get started. You can hear me okay? Okay. So we'll go to the next slide and we'll just give you a little bit of information, although Laura, we do know you well. So we'll give you a little bit of information of who we are, and then for anyone listening to this recording as well. So again, my name is Brittany Goodrich. I'm the director of the Kennedy Willis Center on Down syndrome. I've been working in the IDD nonprofit field for about 14 years and really began my career as a Medicaid service coordinator and then supervisor. A lot of my work stems from independent meeting facilitation and conducting consultation for families and service providers. Michelle and I share a couple different accolades with some certification programs through Second Wind Dreams with the virtual dementia tour, as well as being affiliated regional trainers with the National Task Group on Intellectual Disability and Dementia Practices.
I'm Michelle Davis. I've been in the field for about 18 years or so. I began my career in the direct care field. So I started as a direct care provider. I have managed homes. I was an adult day services program coordinator. I am also a certified dementia engagement specialist and a certified dementia care partner through Inspired Memory. And as Brittany said, we have those shared accolades there.
So to tell you a little bit more about the Kennedy Willis Center, if you're not familiar, we're located in Otsego County, but most of our services are offered statewide and some across the country. We are a resource center that provides best practice in the areas of training, research, education, and program development for individuals, families, and professionals in the greater community. And we've listed just a couple learning objectives. I think that's great when we think about presentations, some things that we hope that you'll take away today. Some you may already know. We are going to discuss some strategies that support physical and cognitive wellness, so looking more as prevention. Then we're going to talk about the value of screening for dementia in at-risk individuals. We'll describe the benefits of using a tool as part of that larger screening process, and then look at how do we use that screening tool as part of a way to make a plan for decision-making in the future. So we're going to go over some of the healthy habits that really support physical and cognitive wellness. Michelle's going to be talking more about those preventative tips, but in general, we felt that it would be important to just kind of make a general comment about wellness. I was thinking about how I wanted to start this presentation, and we thought it would be a great way to just kind of put in a couple of introductory slides about wellness and really viewing this as this active pursuit of activities, of choices that we make, of lifestyles that we lead for ourselves and our loved ones. And knowing that it's really not just this static state that we stay in, but really it's this pursuit of something that we hope to achieve. We're always changing and, not really staying in one place. So really thinking about how do we look at wellness for ourselves, but also for our loved ones, having that self-awareness and mindfulness of what's important to us, what are meaningful activities to us, and also recognizing the influence that physical and social and cultural environments have on that for each and every one of us. I put this in here, and I had said earlier for the presentation this afternoon, there's a really great researcher. Her name is Joanne Cannon, and in 2017, she had gone across the globe and heard from over 600 different people, really trying to gather information from them about factors and traits from groups of people who had their life together. And I air quoted it this morning, I'll air quote it again, because what does together mean? But really people who were embarking and engaging on meaningful lives for themselves and for their communities around them. And these were the 15 traits that came up. And I just want to encourage you to think about these. What things are you able to kind of consider for yourself? Are you incorporating these into your daily life? What about your loved ones? And are they incorporating some of these? Maybe not every day, but some of the things, are they focusing on those, and are we weaving those into their lives over the years? And then maybe are there some that we would say that need a little bit more attention from us, depending on what circumstances we're in that moment. So I'll share that resource as part of this PowerPoint presentation at the end, but just thought it was a neat way to think about things for today as well.
Sorry, I started talking without being on mute. Okay, so I'm going to talk a little bit about some different ways that we can keep our brain healthy, right? So some of the things we're going to go over, we're going to talk a little bit about diet and hydration. We'll talk about sleep, we'll talk about social interactions, physical activity, cognitive engagement, and then preventative health checkups. So first, we're going to talk about healthy diet. So I think we all know that diet is very important. I'm sure we all hear that often, but there's a lot of different ways to approach healthy eating. So there are a lot of different considerations we can take. One of those is cultural norms. It's very important that we stick to cultural norms so that people feel good about the food that they're choosing and putting into their body. But each of us is different, and our relationship with food is different. So we want to, know what people's relationships with food are and make sure that we take those into consideration when we're talking about possible diet changes, making healthier choices. So we can do simple little trade-ins, right? So maybe we're limiting the processed food and trying to choose foods that are a little bit, what they consider whole foods or more organic type foods. You can try creatively adding some green leafy vegetables to meals and snacks. I always like to share when my children were toddlers, you'd mix up all those veggies and grind them down till they were like nothing. And then they have no idea that the meatloaf that they are eating is full of yummy, good vegetables. We can make creative food swaps. So maybe instead of, that greasy fried chicken, we're maybe choosing some unsalted, unbuttered popcorn. Also keeping in mind the sugary drinks that we put into our body. So I know that, energy drinks are like the big thing now. They're not great for us. So avoiding those kinds of things. We want to, of course, think about the role of vitamins in our diet and making sure that we are taking in enough to meet those needs. So one of the big vitamins that is low in most of us, especially living in New York, and this time of year, we don't get enough sunshine. So our vitamin D levels tend to be lower in the winter. So, we want to try to pick some foods that are high in those types of vitamins so that we can ensure we're getting them. These are a couple of different diets that are recommended for brain health. Of course, any diet changes should always be discussed with your primary care physician, but you can discuss different types of diets like the Mediterranean diet, which is just very high in veggies, fruits, and healthy fats. There is also the DASH diet, or dietary approaches to stop hypertension. So this diet really helps to lower your blood pressure to keep your blood pressure at a normal level so that we're negating those risks of hypertension. Again, this diet focuses on veggies, fruit, but it also brings in those fat-free, low-fat kind of options, whole grains, things like that. Then there is the MIND diet, which is basically just a mix of those two diets and taking all of the good stuff from both of them and putting it in one spot. These are just some examples of visuals that can be used to help your loved one make a healthy choice about what they are eating or drinking. We can, talk about the things that we should choose versus the things that probably aren't very healthy and should only be done once in a while. I like this visual for drinks because hydration is so important. I'm going to talk a little bit more about that in a second. But typically water is our best option, but water gets boring after a little while. So I like this visual because it gives us more options than just the water. These are also very good hydration options that taste good too. So we'll talk about hydration now. Unfortunately, most adults who are living with intellectual and developmental disabilities are consistently mild dehydrated any day. So all the more reason that we need to encourage that hydration. Um, the dehydration may be exacerbated by disruptions to the person's senses and there's the signals that tell their brain that they need to drink. So again, another thing that we need to keep in mind when encouraging hydration is their body may not be telling them that it's necessary. So we need to remind them. It's important to stay hydrated for 1,000,000,000 different reasons, but we listed a few here. So things like dry skin, dizziness, fatigue, headaches, confusion. It is surprising what being dehydrated can do to you. So some just little considerations, things to keep in mind when we think about hydration. So think about the drinkware. Is it accessible? Is it something that the person enjoys? We've see lots of people with all their little water bottles with the stickers all over them because it makes it their own. It makes it more appealing to them, right? We can implement visual water tracking schedules. There are apps out there that you can use to remind you about hydration as well. There's actually a kind of cup that you can buy that connects to your phone. So if you haven't drank enough, it will send a reminder to your phone that you need to drink more. Mixing it up, like I said, with that visual, it gives you lots of different ideas other than just water. Something as simple as adding fruit to the water. I love strawberry lemonade water, but only when it's the real fruit for me. But you can use, those low calorie sweeteners and things like that too. It can also be helpful to try to eat your water as well. So instead of having to drink it, we'll eat some of it. So all we're doing is adding some of those water-rich foods to our diet. So think of things like melons, berries, cucumbers, and lettuce are like 95% water or something like that. So they're very high in water content. So they're very good for our hydration. These are just some visuals that you can use for hydration. I shared earlier, I love these trackers on the side. I'm a checklist kind of person. So I love the idea of being able to check off that I drank 1 cup, I drank 2 cups, so on and so forth. There are also these, so we've got our little water llama guy there and the woman below him. Those are just examples of some different apps that you can use to track your water. I think the woman's really cool. She fills up, her body fills up as you go through the day. And then just some examples of different sweeteners you can use. Also the cup, I'm sure, or the mug, whatever you want to call it, that has, at 8 a.m. my water needs to be at this line. At 9 a.m. it needs to be at this line. So we have a goal, and which some of us are competitive, and that'll help us, make sure that we drink a little bit more. We'll talk a little bit about sleep. So sleep is so very important for all of us. I could ask anyone right now, what was your day like after you got a night of not great sleep? And I was fatigued, I was grumpy, maybe a little bit of a short fuse, right? And you're not concentrating because your brain didn't get its chance to reset, right? So it's important that we engage in restorative sleep. We can do this, some helpful ways to do this, engaging in good sleep hygiene. So having that nice routine, knowing that, I'm going to brush my teeth, put on my pajamas, go to sleep, whatever the routine may be. Setting the stage can be really helpful. So doing those nice relaxing activities before bed, trying to avoid blue light like our phones for an hour or two before we go to bed. Maybe we have some aromatherapy stuff going on, a little lavender candle, dimming the lights, those types of things. There's also adaptive equipment that you can use to kind of help calm the senses. For me, a fan is my adaptive equipment. I cannot sleep without that noise. It's not that uncommon, I'm learning, so that's exciting for me. But different things like weighted blankets or different types of lotions, maybe a wedge for comfort, a lot of different types of things that we can use to kind of help set that stage, and adaptive equipment we can use to help calm the senses. Excuse me. And then, of course, always screening and discussing any concerns with sleep apnea. This is especially true for our loved ones who may have Down syndrome. People with Down syndrome are at a much increased risk for sleep apnea. So something that we want to keep an eye out for, because if we're suffering from sleep apnea, we're not getting that quality restorative sleep, which is going to affect our brain health. Social interactions. So lots of benefits to social engagement. It stimulates those cognitive processes. So it stimulates our memory, it stimulates our attention spans, our problem solving skills. Good social connections are actually associated with slower cognitive decline as well. So that helps, again, it keeps our brain working, keeps it doing what it should. Social engagement promotes a greater sense of belonging, and feeling good about ourselves is good for our brains. And of course, social engagement, it helps provide that emotional support that can kind of be that little bit of a buffer to stress, right? Like our friends, the people we surround ourselves, can help us deal with the stress of every day. So just some different opportunities for socialization. There's lots of different ways to do that, but we want to try to prioritize that quality time with family, friends, and loved ones. I'm a big proponent for traditions. So maintaining those traditions of maybe, we just did apple picking in the pumpkin patch, that's something we do every year. So that's important for our family. That's quality time for our family. It's different for everyone, but those are our traditions, and that's important, and it helps to, keep us engaged. Participating in community and interest-based groups. So think about your different service-oriented groups. So local food banks, the local youth programs, also spiritual gatherings. Most churches offer a lot of different social activities that you can join in on if that's something you'd like. Different recreational activities, so sports, let's go play 3-on-3 basketball or whatever. Maybe we're drawing a picture, or taking some photos, whatever, different kinds of recreational activities that your loved one might enjoy. And then volunteering and contributing to community efforts. So fun things like helping at the animal shelter, because how fun is it to help socialize the kittens? Not gonna lie. But also, things like park cleanup day or different community events that are going on in your local community. Physical activity. So this, again, it's another one. We know that physical activity is important. There's a lot of reasons why it's important. So it can help assist in reducing the impact of chronic diseases. It can help to strengthen our bones and our muscles. It also reduces the risk of falls, right? The more we move, the easier it is for us to move, and the less likely it is that we're going to fall. It supports continued independence and mobility. So again, we're using the skill, so we keep the skill longer. It improves mood and mental well-being, which, again, a happy brain is a healthy brain, right? Also worth noting that increased physical activity has also been shown to slow the rate of cognitive decline in those that are already diagnosed with Alzheimer's disease. So physical activity is still important until the end of a person's life. We want to keep moving, keep being physical as much as we can. So different opportunities for physical activities. There's tons of things. You can go for a walk, you can dance, do some yoga. Also, things like your household chores can be a physical activity. Think about the movement that you're having to do to wipe down the counter or to sweep the floor. That is a physical activity. Make it fun. I am a big proponent for music. I think music just rules my life. I need it to clean. I need it to cook. I need it to work. So physical activity, obviously I need it for physical activity as well, but it helps to make it a little bit more fun. And especially with music, you can dance, and that's also good for us, right? And then participating in regular activities as you're able. So just being involved in those physical activities. Cognitive engagement is also really important. Work that brain, challenge your brain. So challenging our brain can help to improve memory and increase our cognitive reserves. It helps build up that part of our brain that keeps our memory going. It provides greater resiliency and adaptability to age-related changes. So there are many things that, we're going to have to face as we get a bit older, and keeping our brain nice and active just makes it a little bit easier for our brain to adapt to those changes. And cognitive engagement also, it helps boost our self-esteem and confidence, right? So it feels good. So some different ways that we can encourage cognitive engagement, just fun stuff, right? Things like puzzles, board games, card games, fun stuff. Or writing a letter to, maybe grandma lives an hour away. We can write a letter to her. We can make a card for Christmas. Or it doesn't even have to be themed. We can send a card for no reason except to say hi. That's great too. Spending time outside, maybe, doing a fun little scavenger hunt outside when it's nice. Also do things like visit the library, go to a local museum. One of the positive outcomes of COVID is we can travel online now. You can sit at your computer and go to Paris, right? And experience it just like you were there. Another great way to encourage cognitive engagement is by learning a new skill. So learning something new. I've also read some papers about specifically learning a new musical instrument can be very, very good for our cognitive reserves. And then not lastly, but I'm going to talk a little bit about hearing loss. So there are some studies out there that are showing that hearing loss is a risk factor for Alzheimer's disease or cognitive change. So when we experience hearing loss, it reduces our socialization, right? Because it's harder to have those conversations. It's harder because you can't hear people. So this requires increased cognitive effort, right? Our brain has to work a little bit harder to process what information it is receiving. And there is, as I said, it's statistically significant association between severe hearing loss and dementia in the neurotypical population, which I would argue is comparable to the non-neurotypical population. But the good news, yay, there's good news. Utilizing hearing aids or other corrective devices can help negate those risks. So if we give our body the things that it needs, our brain doesn't have to work so hard because it's going to get that information the way that it needs to. Now, lastly, I'll talk about preventative health checkups. So preventative health is so very, very important, not only just for our loved ones, but for ourselves too. So we want to make sure that we're maintaining our annual checkups, right? Do that annual physical, do that lab work that you've been avoiding. Medication reviews are really important, especially for our loved ones. Very often people are put on a medication and they just don't come off of it. So medication reviews are really important to make sure that we're not giving someone a medication that they may not necessarily need any longer. Perhaps it was necessary before, but it's not now. So we want to make sure that we're always looking at that. We want to pay attention to our mobility, right? Because the more we move, the better. And if we're having trouble moving, there are things that we can do to help with that. Routine vision and hearing exams. As I said, hearing is very, very important. I would argue vision's pretty similar too. If I can't see something properly, my brain's going to have to work harder to process that. Oral health is also very, very important. A healthy mouth leads to a healthy body, which leads to a healthy brain, right? So we want to keep everything nice and healthy. When we're thinking about the different types of screenings for preventative health, we want to think about things like behavioral health, think like mental health kind of screenings. We want to do dysphagia screenings to make sure, you know, everything's working well. Of course, cancer screenings are important. And then dementia screenings as well. And Brittany's going to share a little bit with you about dementia screenings for people with IDD.
Thanks, Michelle. So let's go to the next slide. We're going to talk a little bit about the value of early screening and why it's important. And I think the biggest takeaway is that the sooner that we can identify functional changes, the sooner we can address them and do something about them. Another big important piece of early screening and looking at functional changes is that we might be looking at other types of disease conditions that are mimicking dementia. So we've listed some there: sleep apnea, celiac disease, thyroid disease, some deficiencies in our vitamins, pain, changes to hearing or vision, anxiety or depression can all have different symptoms that are mimicking dementia that we could treat and potentially even reverse, that we want to look at first. Can you go to the next slide, Michelle? The value of early screening can also help to identify, as I said before, interventions earlier or new supports for a person sooner. Instead of being reactive, we're trying to be proactive because we have the information in front of us. As a caregiver, as maybe a family member or even a paid caregiver and a support staff, there can be some anxiety when we see the people that we care about are changing or going through things that are difficult. So having that information available to us can help reduce some anxiety because we're getting answers, or at least we're making a way to find new answers. And it's going to give the team more access to available treatments and help us plan for the future, and then align those services and supports to meet the changing needs of the person. Here's a graph that we like to reference. The data is from 2000, which I cannot believe is 25 years ago, which is wild to even say that out loud. But I still, you know, it's very accurate. I think, you know, we might actually see a little bit higher increase now, especially for the Down syndrome population. We're seeing more by age 60, it's 60%. So that increased a little bit since this time of the graph. But just wanted to acknowledge that otherwise, the prevalence of dementia in people with IDD, not Down syndrome, but other types of IDD, is very comparable to the general population. So we do see some slight increases as we're going up in age, but it is not similar to the much more increased risk that we're seeing for somebody with Down syndrome. And so some of the reasons, we'll talk about this a little bit more, but Down syndrome is one of the most significant risk factors for Alzheimer's disease. It has to do, what we know right now, with the triplication of that 21st chromosome, and it's producing an extra protein in the brain that ultimately turns into the plaques and tangles, which we know are the telltale symptoms of Alzheimer's disease. But at the same time as that is happening, adults with Down syndrome are experiencing what we would call premature or accelerated aging. So we're seeing changes to a person's brain and their body. So physiological changes are happening anywhere from 5 to 20 years sooner than we would see in the neurotypical population. And that's important for us to know, because that means that we may need to be looking for things sooner than we would otherwise. 50% or more of adults with Down syndrome will be affected by some form of dementia over their lifespan. And so again, this is important for this particular population, that we're being mindful and using screening tools as we have them available to us. So some of you, before we started the recording, had acknowledged the tool and being familiar with it. So I'm going to highlight some of the key takeaways from the tool. We've listed the website there. So the tool that we're going to reference tonight was developed by the National Task Group on Intellectual Disability and Dementia Practices. And it's referenced as the Early Detection and Screen for Dementia, so the EDSD. And this is really an administrative tool that can be used by families or other caregivers and agencies to record changes in function. So it's really just, if you think, a really robust record-keeping tool. The website is listed there, and again, you'll see this on the PowerPoint, but you can go to that website. You can download it and use it as a fillable PDF. You could also download it and print it if you would like to do it in a hard copy format. So probably the most important thing, if I could leave you with the screening tool, is just to acknowledge that it's not a diagnostic tool, which means that we're not going to use the tool and we're able to say, yes, this person has dementia, or no, they do not. We are not going to be able to leave with a diagnosis. This is for the general people like Michelle and I, people like yourselves on the phone that may not be clinicians. We're able to use this together on a team level and just really track changes in function. It's going to use an informant-based rating scale. You can see that below in the 4 different categories. And it's going to ask you a lot of questions in 8 different domains, and you're going to put them in the category that makes the most sense. So across the 8 different domains, they're going to ask you questions related to activities of daily living, the way someone is using their language and communication skills, their sleep and wake patterns, how they're moving and ambulating, their memory, their behavior and affect, so their mood. Also, we're going to acknowledge any self-reported concerns that the person themselves has. And then we're going to note significant changes that are noted by other people of the team. I will just acknowledge that there's two of the 8 domains here have a little star next to them. There's been some additional research since the tool was created, and it's been determined that language and communication and memory in particular, if there's a lot of indicators that you're checking yes to there, are a little bit more sensitive as it relates to a future diagnosis of dementia. So if you're seeing a lot of changes in your loved one or people that you work with related to the way someone's communicating or in their memory, you might just want to pay a little bit closer attention to that. So kind of some tips to think about: when do we want to use the EDSD tool? We want to use it when there's any observed changes in thinking, mood, or behavior that are significantly different than what you would say is normal for this person. So it's not just we're forgetting something one time, oh, he, misused or called me a different name just once or twice. It really needs to be a pattern of significant changes that are different compared to what you would be used to. We would encourage you to think about getting a baseline for somebody with Down syndrome at the age of 35. And for people that have other types of IDD, we would ask you to consider conducting a baseline at the age of 40. And if you have not yet, that's okay. A baseline at all of any age is okay to get. But the sooner you can get, the better, because then you can monitor it for years to come and see those changes that they're happening. Most of the time, the tool is repeated annually or maybe every 2 years, depending on how many signals or changes there are. You can also do it more often if there's a lot of significant changes that's happening in a person's life. So again, I think some of you on the phone call or the video have already used the tool, but as a refresher, it does come with a great user manual that's pretty easily understood, and I review it a few times before we're going to go out and use it again. A great tip is to try to collect medical information in advance. And if you're the family member and you're participating, you're going to have that historical information for your loved one. Sometimes there's teams where maybe a family isn't able to participate, so we're just asking the team to make sure they're collecting maybe their last physical or other information from their medical record that would be important. We really want to make sure that the tool is completed by people who know the person well. These aren't new staff that are helping, that don't really know your loved one. This isn't even maybe a family member that hasn't talked to your loved one very often is contributing, because we want this to be people that know the person well, that see them frequently, that are able to give accurate observations that they see. Conducting the EDSD together as a team is very important. Sometimes teams will say, oh, well, I gave one to the house staff, or I gave one to my loved one's employer, and then one to the community worker. And then we came back and just kind of put them together. We would really encourage you to try to do this together as a team. It just offers a great way to have a good dialogue with each other. You may be able to kind of see themes emerge, or you might see things that are happening in a different setting that you weren't aware of. So as much as possible, trying to have the whole team there is a great option. The tool in general takes anywhere from 30 to 60 minutes. It really depends on the person, it depends on the conversation, but that's pretty much a general estimation. Michelle and I have put some screenshots in here. I'm going to go a little bit quicker just to acknowledge the time that we have left. I know that these slides are very small. The screenshots have a lot of text and are hard to see. But I'll kind of just review what's on here as best I can. You can see page 2, we're really just collecting other demographic information. I think the most important thing that I like to acknowledge is number 14, which is significant recent life events. These are questions that you might be asking. Has the person had a death of someone close to them? Have they had changes in their living arrangements or their work or their program? Is there a new housemate? Have they had a long-standing illness or impairment? Has there been a reaction to medication? The reason these questions are being asked is really because if you think about it, if I've experienced a death of someone close to me, if I've had a long-term illness, I am going to act and behave much differently. And that might indicate some signals later in this tool that really have nothing to do with me cognitively. It's just my life experience. So I would say that if there's a lot of significant events or something very important that's happened in a person's life, you might want to stall a little bit and wait until that person has a little bit more of a regular baseline to move forward with the tool. Page 3 and 4, again, we're getting into the different domains. You can see the bolded different categories and then the different questions above where they're gonna fall into each column. Again, you're just going to work through and ask the questions and have the conversations. I think it's important to see, especially under language and communication. There's one question here that says, does the person follow simple instructions? That's kind of a loaded question to me because we have to first know if the person is able to follow instructions previously. But then also you need to know is what you're asking them, if they're refusing to do something, is that just a choice that they're making? Or is that really because they're not understanding or not able to complete the task? So you want to be having those types of conversations with the entire team to make sure that you're being as accurate as possible. Michelle, we can go to the next one. This is the 4th page, and it includes the 8 domains. So we've got memory, behavior, the adult self-reported concerns, and then the significant concerns reported by others. Sometimes on the tool, you can notice there's some double negatives. So just try to look at that question and make sure you're answering it accurately. I think the same thing again is what I just mentioned on the last slide. There's a question here that asks, are there problems with learning a new task? Well, is it a task that the person actually wants to complete? Because I might ask someone to do something. Hey, could you clean your room? Do they want to clean their room, or do they really not remember the steps of, oh, I need to make my bed, or maybe I need to put my clothes in the hamper? And that's a different type of conversation. So again, you can use this tool to kind of think about, are there opportunities to support the person different, depending on what the answers are. This is the medical section. I wouldn't say it's fully encompassing, but man, it has a lot of stuff on here. So as best as you can to collect the medical information in advance, you're going to determine whether it's a recent diagnosis, whether it's been in the past 5 years, or if it's been 5 years or more, which would be lifelong, or the condition is not present. So you'd be checking those boxes as appropriate for the person that you're conducting the screening for. And I think it's just important here too, a lot of this, you might see that, you know, we're really lighting up recent conditions under sensory, which is impaired vision and hearing. That might not have anything to do with the dementia. That may just be some other sensory things that are going on that we need to just follow up with our PCP on. So a lot of times this tool can also lead you to other things that you need to explore medically as well for a person. This is the back page and the last page of the tool itself. At the top, it's asking you questions related to medication. So is a person taking a medication for a chronic condition? Are they taking any sort of mental health medication or any medication for pain? And then you're going to kind of note some of the next steps as well as what you want to do. Do you want to share this with your person, your individual's primary care physician? Should it just be reviewed by an internal clinician if you have that available to you? Maybe we just don't need to do anything with it and we're just going to meet again in a year. If you do choose to review this with your physician, there is a great manual that comes with it. I think Laura, you had mentioned it. You know, it's kind of hard sometimes to go into a doctor's office and say, here, I have this assessment. Sometimes doctors don't want to hear that, and some are very open to hearing it too, but the manual would give them some more information and hopefully encourage them to take this assessment that you provide to them seriously. So we've kind of mentioned this throughout, but the EDSD tool, once you have it done and you kind of look at all where the signals are, you may find themes or different patterns. You may see, oh, everything is really falling in this memory section. And then you can talk about that. Sometimes you're going to see that there's discrepancies. You may not be seeing something as a family member, but the day program is, or vice versa. And it's a great way to have a conversation about that and to see maybe what needs to be changed, or maybe what are you doing differently at home that maybe the day program needs to adopt to help that person be successful. If you go to the next slide, Michelle, I think there's more that talks about, again, what to do with the tool. Really can be a great point of discussion for your primary care physician. It can be a way and a means to maybe get a referral to a specialist if needed too. You know, sometimes it's hard when we go into a physical, especially if our loved one lives in maybe a certified setting and a staff is going with them. Maybe you're not able to go with them. This is a really great way to make sure that what information is being relayed is accurate. And it can be, again, a great point to use year over year. So you may find by using the tool that there's some changes that need to be made, or maybe some new supports that your loved one needs to have in their life to be successful in their program or their employment or at home. So you may look at different decisions related to the caregiver or staffing support. You may find that a certain living situation or a program environment needs to be modified to better meet their needs. You may find that we need to incorporate some new activities for positive engagement. That's going to help them feel good and feel happy during their day. Or as already said, you may find that this is something where we say we need to look into this further medically, and we need to meet with a different type of specialist. So a lot of times people will ask, you know, again, the tool itself isn't going to tell us whether we get a diagnosis or not. And unfortunately, right now, dementia is complicated. There is not one single definitive test that is used to diagnose dementia. It's really instead a diagnosis of exclusion. There's going to be a lot of different things that you rule out first, and a lot of different testing that goes into whether or not a person has that diagnosis or not. We also know that some of the standardized tools and testing and even the medications are not suitable for people with IDD or including Down syndrome. And so there's more information and more research happening right now that we're looking forward to seeing what comes from it. Again, making sure that we're ruling out different conditions that can mimic dementia symptoms is a really important first step. And then using the tool as part of a larger combination of assessments and testing can be really helpful as well. So I hope that you'll find this tool, Michelle, you can advance it again. I hope you find the tool, you know, worthwhile to use. We've put a lot of resources, whether some of the information Michelle shared early about prevention, as well as some of the things that I discussed as part of the resource, the literature here on this slide. And the next slide, we put in some really great engagement resources that we hope that you'll explore and look into. Just a reminder for some of the available services that we can offer through the Kennedy Willis Center. We've listed our phone number. Please feel free to call us. Anything related to aging, dementia, that's the services that we're offering, LifePlan and ACANY, and we've continued to offer. There's newsletters that are available, the baseline screening assessment. If you're not comfortable facilitating that on your own, we would be happy to do that for your loved one. Please just let us know. We have a variety of different webinars and other resources that are available to you. And we can also just even attend a LifePlan meeting if you would like to, you know, with your permission and your loved one's permission. We'd be happy to sit in and listen and even just brainstorm if that would be helpful. I think that's kind of it. I want to leave some room in case there's any questions, but there's our contact information, which you'll also receive as part of the presentation.